Hello, this is Karina from Stroke Surviving the Odds. The show's mission is really to help stroke survivors move forward past the events of the stroke, reclaim their identity and their lives. And today's guest is exactly doing that. She is an example to follow. So I would like to welcome Stacy. How do I pronounce your last name, Stacy?
Pietrahita rhymes with margarita.
Ooh, I love it. You see, I gotta look at it. Pierajita. Pierajita. I
Pietrahita.
love it. I
Me
love
too.
it. So, our show today is a very candid, very raw, very authentic, very, as a matter of fact, we did schedule time together, but we decided as a unit to make it very comfortable. So, that being said, let's get the show on the road. Tell us a little bit about you. Who is Stacy?
Oh my goodness. That's a loaded question. I wear a lot of hats. I used to be an oncology nurse. I was a nurse for 27 years. I've been in healthcare for about 35 years. I unfortunately had to medically retire in 2022 after an electrocution. I was electrocuted.
Wow.
Unfortunately, I was not able to go back to nursing, so I kind of had to find a new path. So I got into Reiki, I got into the holistic healing modalities, and I've just been focusing on healing my body ever since the electrocution. And then, surprise, I had a stroke.
Well, I'm going to stop you right here. Your story that's why I wanted you here. You are really amazing. You need to tell me about the electrocution. How did that happen?
So my husband and I were camping. Nature and the mountains are my happy place. So we went on a camping trip with a bunch of our camping buddies, and it was the first day we arrived at a hip camp. And a hip camp is a property that someone rents, but it's on their property. So we were with, 5 other vans and 5 other campers. We had just arrived, and as soon as we got there, I saw a petting zoo. And I love animals. So as soon as I jumped out of the car, I ran up the hill and I saw this goat with a really pretty pink sparkly collar that I wanted to say hello to. Well, as soon as I walked up to the fence, not realizing it was electric, I had put my right hand on the fence, screamed, and I dropped. And
Wow.
it has been a shit show ever since. It's been 3.5 years. It's been an adventure. I'm finally able now to talk about it without falling apart. I've done a lot of therapy, but yet it changed everything. It changed my life. It drastically changed everything. So.
Wow. So which one came first? Which bad luck came first? The stroke or the electrocution?
Well, in terms of bad luck, I would say in 2021, I had my breast implants removed, and I had, unfortunately, a near-death experience. My breast implants were poisoning me. So honestly, it was my breast implants in 2021, my electrocution in 2022, and then the stroke at the end of 2024. So it's been a shit show.
Oh my God. Yes, you can say shit show. You're allowed to say that. Absolutely. I told you guys, the audience, that Stacy had a lot of surviving to do. I mean, wow. So you talked to us about therapies. Did you, before your stroke, were you doing therapy?
Yes, I chose, let's be real and honest. I had a nervous breakdown in 2020. I was working as a clinical manager at a huge home health company, and my partner was just fired, who was also my best friend. And all the work was on me. I would 24/7, I was working. It was way too much. And I had loved this job. It was the best nursing job I'd ever had. It was too much. So it was Memorial Day weekend, and I had just had it. Like my body shut down. I didn't know what was going on. So I started therapy back in 2020. So I have been in therapy. Like I know a lot about
Okay.
therapy, but I realized instead of making everything disappear that happened to me in my childhood, I decided to confront it hands on.
Love it. Love it.
So,
Okay. You killed two birds with one stone, right?
yeah. Yeah.
Basic. Oh my goodness, Stacy. I knew I loved you, but now I love you even more because you are a hell of a fighter. So I have so many questions since I met you a few weeks back that wow. So you did therapy when your partner at work lost his job, got fired, you were 24/7, you were
Horrible.
overloaded, and no kidding. And you had, from what I understand, your childhood in the background.
Yeah.
Your generational trauma, I'm guessing.
Horrible. Horrible. Yeah.
Okay. So you figured I'll work on all that.
Yeah.
Now, before we start talking about that, there's a lot of components to you. I see how complex individual you are. Tell me, how did your oncology specialty help you in healing the parts of you from your childhood, from that generational trauma?
Honestly, it was getting out of my own way and thinking, how can I serve other people? How can I help
Love
other
it.
people? And I could not be the best version of Stacy without going to therapy. And honestly, oncology taught me so much about myself because I was able to go to work and focus on these patients that were literally, had a death sentence, and I was able to see things from their eyes and appreciate life so much more.
Wow,
It
wow.
it allowed me to appreciate everything I was going through and realize, you know what? I'm not the one sitting in the chair getting chemotherapy. I'm able to show up with a smile on my face. I'm able to, and my patients would always tell me, they always requested me because one, I would always get their IV first time. I was an excellent IV nurse, always get their IV the first time. But they would actually
Important.
yeah, they would actually say when they come and see me, they forget that they had cancer. So to be able to give that kind of gift to
Oh,
people,
man.
it changed my life. It changed my life. So,
Okay, wow. No kidding. No kidding. Because you had that baggage from before, I think that baggage, that empathy and that compassion that you had, the best way to heal ourselves that I found is by helping others. And you're a giver. You're helping others forever. So all that I could see how it helped.
yeah.
And now we'll fast forward. If it's okay with you, you tell me when you need to take a moment. I have some relaxing not questions, but yeah, I am curious. Inquiry minds want to know. So we'll leave the serious on the side, we'll go to the funny, and then we'll come back. Okay? You lead the show.
Okay.
You lead the show. Okay? So if you don't mind, what happened? So the day of the stroke, you want to walk us through that?
Yes. So the day of the stroke, it was December 28th of 2024. I had just gone to see Christmas lights with two of my friends. We walked a couple of miles just looking at all the Christmas lights. We went to dinner. We had the best time. It was wonderful. And I had just gotten back from 2 weeks in Philadelphia. I went home for my birthday. That was my birthday gift. And my friend had just dropped me off at my house. And I was walking the path to the steps because my husband and I live in an apartment, and I'm just walking, and all of a sudden I dropped to the floor. I didn't lose my balance. I didn't trip. I dropped. So
Oh boy.
it's almost like my legs gave out and I just dropped on the floor. I don't remember if I hit my head, but I damaged my right hand pretty severely. And my friend had driven off. She didn't even notice because, she dropped me off. I was good. Bye. Everything was good. And as soon as I realized what happened, I didn't think anything of it. I'm like, oh, I just fell. I just fell. So I was able to get up and I was able to walk up the stairs and I knocked on the door. Did you have a question?
No,
Did you
no,
have
I was following. You got up and you went up.
Oh, okay. Okay.
I'm following the story.
So I knocked on the door. My husband's like, why didn't you use the key? And I hold up my hand, which is covered in blood. And I'm like, I fell. And he's like,
So that was the problem, not this. For you, the hand was the issue.
I didn't think anything about there was anything wrong with me at all. So, my husband cleaned up my hand. And I just kind of nursed it for, being a nurse. I was like, I'm not going to go. I'm not going to call. I'm not going to do anything. But I ended up developing a fever New Year's Eve. And I was really it was like 103. And I have severe medical PTSD. Unless I'm dying, I'm not going to a hospital. So I didn't go to the hospital. And then 2 days later, I made an appointment with my primary. And she's like, it looks like it could be infected. We can get some cream, blah, blah, blah. So, yeah, it just started out as a simple hand injury.
Wow. Okay, so I need a break right now. Wow, this is oh my God. Okay, so I need a break. So, Stacy, you're an outdoorsy person, off subject. You're an outdoorsy, you're very beautiful, and you have very nice, clear skin. Now, after your stroke, having been on medication and all that, how important was skincare to you before and after the stroke?
Not at all. I couldn't afford anything. I've been on disability, so I literally have been using coconut oil for the last 4 years. I don't do anything to really.
Okay.
I don't wear
You're
makeup.
a natural beauty.
That's what my daughter says, but thank you. But yeah, I love coconut oil, and it's only because it's all I could afford.
Okay, well, coconut oil has many benefits, so
Yeah.
I think it's very important to ask women that question, especially because tell me what you think. When I was in the hospital, I was taking so many pills, and when I was in rehab, the same thing, that my teeth were really yellow and my skin was dull, like some of your patients in oncology, right? So for me, having a skincare background, aesthetics background, and all that, for me, skincare saved it really boosted my energy and made me get back. So that's why
Oh,
I
wow.
said, I gotta ask.
Yeah.
But you know what? Keep using that coconut oil because it works. It's working wonders. So, your hand, you go see your primary, you think your hand is infected,
Yeah.
you
So,
still don't know you have a stroke.
oh no, I didn't discover it was a stroke until 4 months later. So I had started, and this is crazy because this to me is like, looking back, God was with me every step of the way. I just wasn't following. So I had started doing Qigong meditation years and years ago, but I had started getting into mudras and mantras. So I noticed when I was trying to meditate, my right hand it did not feel right. Something was off with my right hand. And I was having this horrible fatigue. Now, ever since the electrocution, I've dealt with fatigue in general. This was something I could not explain. So I started going to my doctors, telling them something is not right. And not one gave a shit. Like, no one really cared about anything. And so it wasn't until I just kept getting worse and worse. Like, I was getting shortness of breath walking. Like, things were changing in my body that I couldn't understand. And it wasn't until I went to see my chiropractor and I'm like, I don't feel right. Something is wrong. And he was concerned that it was a cerebral spinal fluid leak based on my symptoms because he did my reflexes. He did a bunch of neurological testing and he's like, something isn't right here, Stacy. You need to go to the ER now. Well, it took 6 visits in 1 week to the ER until they finally admitted me. They finally admitted me because
Wow.
Kenny and I went, and again, I hate going to the hospitals, but I didn't know what was wrong. And I'll never forget because Kenny and I ended up going to the hospital like 4 a.m. And luckily it's right across the street. So it's pretty close. No one was there. And the doctor's like, I don't know what do you want me to do for you? And I'm like, this is my 6th visit to the hospital. Something is wrong. Can you at least do a fucking MRI or something? Please, something is wrong. So
Yes.
finally, by the love of God, he admits me. So they do the MRI. They do a CAT scan. They do an MRI. And it was the next morning. And understand with my nursing background, I can navigate a lot of things that most people are like, the hell does this mean? So I read my MRI because it posts immediately. And I'm like, why does it say chronic infarct? And I'm like, that's a stroke. So I call my husband and I'm like, babe, I think I have an answer. And I'm like, I think I had a stroke. And he's like, what? It made sense. Every symptom, it's almost like the universe aligned and was like, you had a stroke, blah, blah, blah. So I was scheduled to see the neurologist in the hospital the next morning. So
Yes.
the doctor comes in. Now, understand at this point, this was 4 months after my fall. I can barely walk, can't use my right hand, can't toilet myself. Like I was like in bad shape. So my husband's on the
Wow.
phone. Doctor walks in and she's like, yeah, we're going to discharge you. Hello, Houston, we have a problem.
Okay,
I have
I'm flabbergasted here. Wow.
you. I'm still blown away by this. So my husband's on the phone and he said, did my wife have a stroke or not? And this is what they say.
Yeah.
Yeah, but the neurologist at Duke can take care of her. We can't do anything for her here. And I'm like,
What?
first of all, now understand, I had a neurologist in the past because of all the issues from the electric shock.
Yes, yes, yes.
Neurologist would not see me. The neurologist wouldn't even talk to me. They completely discredited everything. And so my husband's like, you can't just discharge my wife. And I did not have insurance at this point. And my husband got so angry, he ended up hanging up the phone. So I'm sitting there looking at the doctor and I'm like, I can't take care of myself. My husband works full time. I have no family in the area. What am I supposed to friggin' do? And luckily, by the
Yes,
love of
yes.
God, she must have felt sorry for me because she ordered like 6 sessions of physical therapy, like home PT. So
Okay.
at least I thought I had a plan. At least I had a
Yes.
plan. So she ordered, what else did she? Yeah, she ordered 6 visits of PT and I think 3 visits of occupational therapy. So I was discharged. I was home by myself. I was very depressed. I had to call my kids. My daughter had to come take care of me. Luckily, my son at that time, he didn't have a job. So he was able to come home and help me because I was helpless. Like I didn't know what was going on. And the worst part
Still
is,
can't believe they sent you home.
oh, it's horrible. But again, welcome to healthcare in the United States. I mean, this is just normal, which is sickening to me. So I finally got in with a neurologist. Now my chiropractor thought I had MS. He thought it was either a CSF leak or MS based on my symptoms. Like it was wonky symptoms.
Yes.
And my husband took the day off and we went to see the neurologist at the hospital. And he basically said, didn't even acknowledge the stroke. He's like, yeah, basically your issues are because of functional neurological disorder and you can go to a clinic in Charlotte. There's nothing I can do for you.
Okay. Wow. So I'm just gonna stop you here right now. Um, that must have not make you feel very supported.
I was extremely depressed, and that's what led to extreme depression. That led to me planning my own death with a death doula. Like, I was done. No one was helping me. And I felt so helpless because I was like, it's on the MRI. How can you not acknowledge based on my symptoms? Horrible.
Wow. I can't imagine how. So now that you had all this happening to you, and you are you're so vivacious, and you have really a joie de vivre. So
Thank you.
you said you were severely depressed, like, and all that. So how did your mental, because I'm guessing you were still doing therapy before the stroke.
Right. But we didn't know what it was. So they were just like, yeah, you're
No.
depressed.
Okay. Okay. And after the stroke, you continued. So what kind of therapy did you do? Once, how were you diagnosed having had a stroke? Because now they're like, we don't know. We don't know.
Yes, finally, thank God, I saw a neurologist on June 30th that is like, yeah, you had a stroke. And he ordered everything for me. You know, he put me on a aspirin protocol. He put me on everything that would help. He put me on aspirin, and then he helped something with my cholesterol. He ordered physical therapy, speech therapy, the stuff I should have had months prior, he ordered, and that's what changed everything around. The fact that he believed me and was just like, I seriously can't believe what has happened to you. But he turned everything around. And ever since I've been seeing him, you know, it gave me this sense of, I knew I wasn't
Hope.
crazy. It gave me a sense of hope, and it was a new beginning for me. Yeah.
You thought you were crazy?
Oh God, yeah. After all the
You were.
doctors are telling me it's in my head, yeah, you don't, when you hear it so many times, I was like, you know what? I guess I am crazy. I guess I'll never get help. But this has been ever since I've been sick. You know, I've got such wonky symptoms. I have a lot of invisible illnesses. So the doctors don't credit that. They just want you to make you think you're crazy. And I did. I felt it was the lowest point in my life, but it was the most transformational, is what I can say. It was the best thing that ever happened.
Thank you for sharing this mistreatment. I have no choice to call it like that. I will tell you what. If I'm correct, I have 69% of my audience are from the States.
Okay.
And I love that you are calling it. You're saying it like it is, like it was at the moment. And I'm really sorry you had to deal with that. I mean, Canada and the States are very different. So I'm really sorry you had, and I'm so happy. I always tell the audience, you are your best advocate. And you, my dear, where you held on like a dog on a bone, until someone listened, until someone did it. So good on you. Good for you. So once that doctor finally listened to you, how did that pain that you had thinking like you said, you were unfortunately thinking of your own death, you were thinking you were crazy, you had a lot of these illnesses were internal, but coming out on your body, also your hand, your wrist, your legs.
Yeah.
So
Yeah.
what I'm getting to is the pain body. Did the pain alleviate once the inside pain got better? Once you were still doing therapy, you felt supported by your doctor,
Mm.
your
So,
husband.
yeah. So it's not like it wasn't more so the pain. It was feeling a disconnect on my right side. But as soon as it's almost like the minute I had that validation, it empowered me because I was like, this neurologist finally believes me. And now I'm on the right foot. I'm taking the right steps now to get healthy and becoming the best version of me. It did more psychologically. Physically, I still have issues like with my
I
spine. I
love
still have
it.
a little bit of issues, but psychologically, it changed everything. And it gave me a strength, like you said, a dog. I'm like a friggin' pit bull. Like, I'm like, I will never, ever be treated the way these assholes treated me ever again. It'll never happen ever again. So it empowered me.
Yeah.
Like, there's so much beauty in the pain that I had to go through, but looking back, I'm a completely different person post stroke. Like, I'm a completely,
How? How? How so?
I'm not afraid anymore. I'm not afraid of looking crazy. I'm not afraid of saying there's a problem here and you're going to fix this. And I'm also able to look at my own internal body and heal from within, which is helping everything. Like, I am healing from within and I'm seeing changes in my body that I've never felt in 58 years. Like, I'm seeing such
Really?
beautiful changes. Yeah, I'm more connected to my body now. The stroke forced me to look at my brain health, forced me to look at my cognitive abilities. It forced me to say, we're done. I'm not going to get worse. I'm focused on healing my brain, and that is it. It changed everything for me. It changed, blessing in disguise. Blessing in disguise.
If I may, because we're two girls with very similar background, um, listening to everything, I have to also call it as I see it, okay? Life sends you obstacle number one, removing your breast, you had a leakage and a poisoning and whatnot, right? You didn't listen because you kept on working it out and thinking you were superwoman. That's the way I see it, okay?
Yep.
Then you got electrocuted. Thing number two. Life is telling you, hello, Stacy. Calm down, Stacy. You're too nervous. And I attribute that nervousness to your baggage. Do you
Yep.
agree?
1000%.
Okay. Now, you still said, no way, I'm superwoman. I'm going to get out of this. My story is not that, but, and you just kept on going, hello, you had a stroke. And how do I know to tell you this is that I have done the same thing. And that fear and I'm not a fearful person, but tell me if you're like that. Now that you've gone through all that, you listen to yourself a little bit better.
Yeah. 1000%. I trust myself. I trust my intuition, and I trust God. 1000%.
Love it. Love.
Yeah.
Absolutely, absolutely. The same thing happened to me, Stacy. Nothing like you, okay? But as far as life sending me cues to calm down, I was at work going through a lot of stress also a few years ago, and I had chest pain, and I ended up taking the ambulance. The ambulance picked me up, blah, 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 okay? That was thing number one. Go back to work. Don't take the time I'm supposed to be taking. Go back to work. Ayoy. Thing number two happened. I'm listening to myself and I'm saying, I am not going to wait until I get a heart attack. I'm not going to wait until God says, damn it, Karina, what's wrong with you?
Right.
Right? So we deal with our shit. We deal with our crap. That becomes beautiful trauma.
Yep.
That
Very
becomes beautiful trauma. Beautiful, traumatic life, right? I know your husband. We've talked of your husband. He sounds amazing. You've talked about him often, and he sounds like your biggest fan.
Today's our 12-year anniversary of the day we met, too.
Wow, of the date. Wow. Anything planned?
No, he had no clue.
Of course.
Typical. He's my big, yeah, he is. He's my biggest cheerleader. I honestly, I met him a week after I left my ex-husband. He was only supposed to be a fling. I was so dead inside. I just wanted something different. It was never supposed to turn into what it was, but he married me sick. He married me disabled, and he never
Wow.
once has he made me feel like a burden. And I struggle with that from, childhood neglect and abuse. And never once has he made me feel like, oh my God, you're too much, or oh my God, you're dramatic, which, friends can do that. People can do that to you. And he is my soulmate. He's my match in every way. And I just thank God every day that he came into my life, because he's the one that brought me to camping. He showed me the simple life, and I wouldn't change it for anything. I wouldn't change it for anything.
Wow. Wow. From what I understand, he brought you a lot of stability.
Stability and security and safety. I never knew what it was like to feel safe with another person. And by him loving me at my darkest moments, it turned everything around. Like, I watched. The hardest part for being an oncology nurse is watching people leave. And I watched more husbands leave their wives going through treatment. And I was like, oh my God. And it's heartbreaking to watch it, but he's never left my side. And it's a rare thing to have someone love you in your darkest moments.
Wow. And the fact that wow, he married you when you were sick.
yeah, really
That
sick.
is
Yeah.
a testament of seriously. If that's not the testament of love of the man, I don't know what is. And tell me, your children, you have two, you said, your daughter and your son?
I do, but they're all grown up now. My daughter just got married
Yes.
last year. My son is actually going to be.
Congratulations.
Thank you. My goal was to walk her down the aisle, and that's all I could see earlier last year, because I was like, what am I going to show up in a hospital bed? I was, of course, expecting the worst, but yeah. So she's got married. She's good. And my son's going to be 30 this year. So yeah.
Wow. You're a hot mama. You're a hot mama. You said you have a little bit of physical impairment. What do you have? Because obviously I don't see you right now walking and all that. What do you
Oh,
have?
well, I have a lot of cognitive issues. I deal with severe fatigue. I can only do one thing at a time, which is I learned through cognitive rehab. I can't be around a lot of people. I get so overstimulated, and it's almost like I turn into a child. Like, I just get very
Okay.
emotional. I cry. I
Okay.
can't hear any sort of bad news. Like, everything, I'm such an empath. It affects me
Okay.
viscerally. um my writing is still affected. Like, I'm now still doing occupational therapy. I love to write, and I can only maybe write one or two sentences, and I get such fatigue in my hand. um usually by Usually, like I told you, mornings are better for me. Usually, like by 2, 3 o'clock, I have to turn everything off, and I need quiet. Like, I can't be around drama. I can't be around toxic, because
Okay.
it's
So
too much.
it's really your head is heavy.
My head is very
And
heavy. Yeah. And the other thing is, I also deal with, sometimes with my balance. I have to be honest, I still do live in fear, because I just dropped out of the blue. So sometimes when I'm walking, I have to slow down. I have to walk one step at a time, which I'm like, I'm a northerner. We do everything fast, 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 but I have to do everything intentionally slow, very, very slow. And I'm still getting used to that, because I want to do so much. And my husband likes to remind me, sweetheart, you are disabled. He's right. And, I can't take on too much anymore. So I do one thing at a time. I had to distance myself from a lot of people, because it's like, I need quiet. Like, I have to continue healing in quiet and privacy, off social media, just being quiet. Yeah. Heart centered, quiet. And I'm loving it. I'm loving the peace. I'm loving the serenity. I'm loving
how's
the
the
connection.
hands?
You know, I can do things better. but I still notice there's a fatigue there. There's a fatigue, and the days that I'm off, I can feel it when I wake up. I also have dysautonomia. I've got mast cell activation disease. I have lupus. I have rheumatoid. So I've had a lot of other health issues, but the days that I'm off, my blood pressure will be high. So I have to kind of stay in bed that day, and I can't do
Okay.
much of anything. So every day is I don't want to say a shit show because I feel truly blessed, but I don't know what the day is going to bring because it changes all the time. So,
Mm,
but I'm getting better.
wow.
I'm on the right trajectory. I feel like I'm finally in a better place mentally, um, better physically. I just have to continue to remind myself, slow the hell down. Just slow down.
Can you do me a favor and tell the listeners and the audience? You said something interesting before. You have to intentionally. You're Latina, yes?
No, my husband's Colombian. That's where the name.
Okay, okay.
I'm a
But
little Jewish girl from
you're very
Philadelphia.
fast, and you have to intentionally slow down.
Yes.
So the word intentional. Can you give the audience your definition because I use that word a lot, to be intentional in
Right.
life. Can you
Right.
give your definition?
For me, being intentional means to take a pause and really think of what you're doing and why are you doing this. So take a pause before every moment. Take a pause before a conversation. Take a pause before you talk to a friend. It's just being intentional with what I want to bring and give to this world. So it's living consciously aware. I'm aware of my surroundings. It's living in the present. And the way I can be more present is by being intentional and just giving love wherever I go. I choose love over fear every day, and I have to wake up with that intention. And I just have to remember I'm just here to give love. I'm just here to give love. And that's what intentionality means to me, and being present.
That's perfect. I think we all have our different perception, different understanding, and I think it's a question that needs to be asked because we all have different ideas. And I love, you see, you said that we have to be intentional when we speak to people and not just blurt out stuff. Now you taught me something.
Oh,
You taught me to be intentional doing that because I sometimes I have verbal diarrhea. and what would you say to fellow stroke survivors, fellow survivors? What would you tell people to uplift and give hope?
to uplift and give hope, I would say you have to work on radical acceptance. One, your life is going to change immensely. Your friends are going to change. Your family is going to change. People are not going to understand what you're going through. So I want people to understand that. Don't feel that there's something wrong with you, and do not take it personally. Do not
There's
take
nothing
anything
wrong.
personally. Yep. Do not take it personally, and understand, kind of like, it's so hard because I'm very faith based. So it's very hard to let go and let God until you're actually forced to let go and let God. But
Yep.
honestly, acknowledge the change, welcome, and go into it with radical curiosity. What is happening to my body? Why is this happening? All right now, things friggin' suck, but you know what? It's going to get better. It's going to get better. And honestly, I was so desperate for community because I didn't understand what was happening for me. And I truly learned the more you go inward, the more peace you're going to have. Don't be afraid to isolate yourself during this time. Let God heal you. Let God talk to you, and just listen. Just listen.
That is, I love it. That's all I
Reverend
can
Stacy in
say
the
is
house.
honestly, I love what you said. Go inwards.
Yeah.
Go inwards. When in doubt, always go inwards and with God.
Amen.
Any final words? Because I mean, I honestly, I knew that like I said, I knew I loved you. I knew we clicked, but like, I feel like I know you a lot more, and I know how strong you are. So wow, 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 wow. Thank you so much. Wow. Thank you so much for really sharing your story, being raw, and really being vulnerable. It's a gift that you give people by being vulnerable. What people don't feel alone. For one, I don't feel alone. So thank you for that. Do you have any final words? Something we didn't talk about that you'd like? Anything at all?
So, yeah, it doesn't matter what disease you're thrown at. You're not going to go through this life without something going on. Whatever it is, look it in the eye, tell the devil to fuck off, and handle it with everything you've got. And it'll make you a much better person. The person coming out of what you're going into is going to be a friggin' superhero. Embrace it all. Embrace it all.
Love it. Love it.
Thank you.
So, guys, I mean, Stacy is phenomenal. I'm not even going to attempt to say your name without reading it. So, Stacy is phenomenal. I hope that she gave some tough love and some amazing life lessons. And if she can do it, you can do it too. I think this is what we need to. You agree with that, Stacy? If you can do it, they can do it.
Yes, and don't let anyone tell you that there is nothing wrong with you. If you trust your gut and just fight, fight, fight. Don't let anyone tell you that it's in your head and make you feel less than you truly are. Believe in yourself. That's it.
Love it. So this is Stroke Surviving the Odds, the podcast. The show is going to be airing next week, the 11th or 13th, I'm not sure, of January 2026. And we are getting ready for a great quarter, a great 12 weeks of guests. And Stacy, I can't thank you enough for being with us today. Thank you. And for listeners and audience, stay tuned for more.
Thank you. Bye.